the expert IVF patient. Now, this might sound a little bit of an oxymoron, but if you want to find out why you need to be an expert IVF patient, please watch this entire video. I'm Dr. Malpani. I'm an IVF specialist. Our website is at www.drmalpani.com on the web. And in the real world, our clinic is in Colaba in Mumbai. And Dr. Anjali and I, that's my wife, we've been treating more than thousands of IVF patients for the last 30 years. We're very good at what we do. So I am an IVF expert. So I'm not trying to make you an IVF expert, because there's a big difference between an IVF expert doctor and an IVF expert patient. And sometimes I actually believe that being an expert as a patient, being an IVF expert patient, is actually far more important. And let me tell you why. Sure, there are lots of IVF doctors, and the truth is not all of them are experts, not all of them are experienced, not all of them are good, not all of them are necessarily ethical, not all of them will actually put the patient's interests first. But the fact remains that there are maybe 1,000 IVF clinics in this country as compared to the number of patients who actually require IVF. So that rather than focus on the doctors, I think it's important to focus on the patients. And I think the important reason for that is you can't control the doctor. You can control yourself. You can't be sure whether the doctor you go to is a real IVF expert or not, but you can make sure that you become an expert IVF patient. And the beauty about becoming an expert IVF patient is you will automatically attract the expert IVF doctor, because you'll be able to differentiate between those IVF doctors who are really experts and those who aren't. And the tragedy is there are really lots of IVF doctors who are not experts. Now, the problem in this country, of course, is anyone can call themselves an IVF expert. All you need is an MBBS degree. It helps if you have an MD degree, but honestly, even that's not compulsory. Isn't that surprising? That there are actually MD skin specialists or dermatologists who call themselves IVF specialists and actually run IVF clinics, but that's an entire tragedy, and I don't really want to go there. But the point is, you don't require anything as far as qualifications go to call yourself an IVF expert. You pass a few exams and you become the expert, so to say, even though you have actually no real life experience. You've never actually seen or treated an IVF patient, because remember, IVF is not offered in medical colleges. So all these junior doctors have absolutely no idea what IVF is, but they all want to become IVF specialists because, hey, there's a lot of money in IVF, or it's high tech, or it's special, or that's the cutting edge. And it's very aspirational for gynecologists to become IVF specialists. But since they can't get hands-on training in their college, they learn all the theoretical stuff in the textbook. That's not very hard. Remember, doctors are great at cramming and regurgitating stuff and getting high marks in an exam. But that doesn't translate into real life expertise when you're actually treating patients. For that, you need experience. So therefore, they then end up doing a fellowship or joining some IVF clinic as a junior or an assistant. And what this means is they remain a junior or an assistant, which means the senior doctor does everything, and they're basically just taking notes or taking a history or just executing and implementing the orders which the senior doctor does, because they're actually just treated like lowly paid interns or assistants. It's a salary which they get. They're treated as employees. Sure, they get that fellowship certificate or whatever, that diploma, but that doesn't mean anything, because the primary purpose of these for-profit clinics which take all these junior doctors is not to educate them. It's actually to increase the number of patients which they see, and therefore they use these people in order to process the patients along the assembly line. Which means you get all these doctors who then call themselves IVF fellows because they've trained at these clinics, but who actually have no personal experience or expertise, because they've done everything only under the senior doctor's supervision. And some of them have never even done any procedures for themselves, because the doctor does everything and they're only allowed to watch, or they're only allowed to prepare the patient. So they've not even done any egg pickups. Forget about doing embryo transfers or all that stuff. Forget about actually designing the treatment protocol. They're basically used as widgets to implement what the senior doctor said. Now, I understand that this is the reality. Now, things are very different in a medical college, because they're designed to treat patients and to teach the junior doctors. But these private clinics aren't designed to teach junior doctors. They happen to do that because they need more warm bodies in order to process more patients. But teaching is not their priority. It's maximizing their profits, as a result of which the training which these private clinics provide is really, really sad. But there's no rules, regulations, quality control, testing, and these poor junior doctors can't even speak up or complain. because they've signed up for 2 years. Now, if they dare to say anything, say, hey, can I please do that case, or will you allow me to do this? And the senior doctor says, who the hell are you? This is my patient. It's a private patient. It's a patient who's actually paying me money. I'm not going to allow you to do anything. They have to shut up and keep quiet. They can't even open their mouth. They can't say anything. So when they actually go into practice, they've never actually treated a patient by themselves. And this is the kind of person who calls themselves an expert IVF doctor. And if you end up in the hands of this expert doctor, you're in serious trouble. And that's why you need to protect yourself. And that's why you need to be an expert IVF patient, by asking the right questions. How do you know what the right questions are? You don't. That's why you need to be an expert patient. You need to know what the right questions are, and you need to be able to be assertive enough to ask them. And if the doctor doesn't reply or give you honest answers, that's a red flag. Please stay away from the doctor. And even if you learn nothing else from this video but just this, that you need to ask questions in order to speak up, in order to find the right doctor, because not all IVF doctors are equally good. That will be enough. And how do you find out what these questions are? That's what we've created our website for. It's www.drmalpani.com. It's the first website in India which was started by an IVF clinic. Now, of course, every IVF clinic copies and pastes our content, and I think imitation is the best form of flattery, so I'm not complaining. But we have over 1,000 pages of information and hundreds of videos, all of which have been created by me. So I can assure you they're authentic, updated, easy to understand. You can watch them as many times as you like, so you'll understand what you need to do to become an expert IVF patient. And if you still have more questions, go to our website and send me an email, and I'll be happy to reply and give you a free second opinion. We look forward to helping you to have a baby, and as an IVF specialist, nothing will give me more joy than this.